Okay. Come on.
John, you want to mute? Yeah. John Peck, mute.
Attempting to.
I'm happy to help him out.
That could be in broad terms. And we get a side look from Jeremiah. Where are we at here? Let me see. Did I see Phil? Oh, there he is right there. Yep. Who are we missing?
You know, I'm looking at myself on my big screen, and I'm a pretty good-looking guy.
I did tell you we're streaming now, right, Bobby? Okay, do we have everybody?
Sure. I think so.
I'm looking around. Doesn't look like everybody here. Huh? Well, we'll know soon enough. Okay. Oh. Okay, you got that, Bob? Ready? Okay. Good evening, everyone. I'd like to call the January Jefferson County Board of Legislators meeting to order. And I will start by reading the preamble, and that is, the meeting is being conducted under the extraordinary circumstance of a public health emergency, aka COVID-19, and under the Governor Cuomo's Executive Order 202.1, without permitting public in-person access to the meeting, authorizing the meeting to be held partially or completely with the members appearing by remote conference call or similar service, and the meeting is being live streamed via the web and recorded, including the participation of the members appearing by remote link. Having said that, we will start under the prep. Sure. Oh, hear that? Okay. Okay. Oh, I just hit the wrong button.
Give us one more.
Go ahead, Bob.
Pledge of allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, for liberty and justice for all.
Okay, I'm trying to adapt to the buttons here that I have to wait. There we go. Okay. Let me see. Roll call members.
Legislator Drake.
Here.
Grant.
Here.
Monticelli.
Here.
Ebewanik.
Here.
Ferris.
Here.
Calarco.
Here.
Gerald.
Here.
Cantwell.
Here.
McBride.
He's there.
Beck.
Here.
Maxon.
Here.
Johnson.
Here.
Reed.
Here.
Goldo.
Here.
Gray.
Here.
All present.
Okay. There's Dan. Okay. Privileges for it. I don't think anybody's in the meeting. Reading minutes of the last session. Is there any request to have those read? Then is there any additions, deletions, or corrections? None? Okay, then they'll stand as presented. Presentations of petitions, notices, and communications.
For this evening, there are none.
Okay. Quick. You can't even hit the button that quick. Reports of county officers and others.
We have a report from the county treasurer on investments and cash on hand. And we've also sent out a report of the county administrator on budget transfers for last month.
There's a lot going on here between operating these buttons and paying attention to the meeting here. So bear with me, folks. Okay. So local laws, resolutions, and motions. So to begin with, we need a motion and a second to waive the appropriate standing rules to permit the introduction of the resolutions that are on the agenda for this evening. That was Legislator Monticelli,
Yes. Seconded by Ferris.
second by Ferris. All in favor, say aye.
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 Any opposed?
I had thought we would have discussion, Mr. Gray.
There's no discussion on, there's no debate on waiving the rules. Yep. Did you, I don't know, did you vote, Mr. Maxon?
I vote no.
Okay,
The rules exist for a reason.
okay. Got that? Okay. Okay. Resolution number 1.
Designation of depositories for 2021.
May I have a motion, please?
So moved. Monticelli.
Legislator Monticelli,
Ferris,
second.
second. Ferris.
Is that Ferris?
Ferris.
Ferris? Okay, discussion? All in favor, aye?
Aye.
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 Resolution number 2. May I have a motion, please?
Johnson.
Holy cow. Go ahead. Yeah, read it.
Designation of official newspaper for 2021.
May I have a motion, please?
Johnson.
Aye.
Okay. Johnson, Cantwell. Any discussion? None? All in favor, aye?
Aye.
Aye. Aye.
Opposed? Unopposed? Carried. Resolution number 3.
Delegating authority of the county auditor to approve certain real property tax refunds.
May I have a motion, please?
Motion, Dolgo.
Second?
Monticelli.
Second, Monticelli. Discussion? None? All in favor, aye?
Aye.
Aye.
Opposed? Those are pretty much the perfunctory resolutions that we do at the beginning of the year. The next resolutions 4 through 17, if we may take those in a block vote, those are essentially continuance of the perfunctory resolutions. That's continuance of decisions that were made at the budget time. So if we need to vote on that?
Motion.
Do we need a motion on that block up here? Is there any objections to going in a block? None? Okay, so I'll take a motion for resolutions number 4 through 17.
Motion by John Peck.
Okay, we got a Nabawanic, second by Peck. Okay, are there discussions on resolutions 4 through 17?
Yeah, Mr. Chairman, I'd like to be recognized. Okay.
Yes.
Yeah, I was wondering, and I know we went through this at budget time and everything, but I was wondering, couldn't some of these be paid for with bed tax money, occupancy tax money. Like 4, for example, is for the promotion of, the county. And several of them are. Some of them aren't. Some of them are more specific than what bed tax should be used for, like ag, but certainly some of them, I would think would be justifiably paid for by bed tax money. And since we, have not, I won't say extra, but we have funds there, wouldn't it be prudent to use some of that bed tax money for some of these?
Hold on here. Bob, do you want to address or do you want me to go?
There are, of that group, there are 2 that will apply to the bed tax money. The first one would be Thousand Islands Regional Tourism Council, and the other one is DPAO. But otherwise, none of the remaining 12 qualify under the current resolution that's in place since, I think, the last, maybe 1980s would be my guess.
You don't think the number 4, the Ag Society, would fall under bed tax?
I'm sorry, which one is that, Pat?
Resolution number 4 for the Ag Society.
County Fair.
We never have before, so at this point, we'd have to research it.
Would be the County Fair, right?
Yeah, and which is fine. I know it's already been budgeted and everything. It's just, there was a thought I had as I was going through these is all. One other question, Mr. Chairman. Well, actually I have 2 more. With the libraries, there seems to be a pretty big discrepancy on the amount of money that each individual library gets. They seem to be pretty much grouped, within, say, a couple $1,000s to $5,000 or $6,000, except for like Black River, Carthage, and Evans Mills. And obviously Watertown, the main library, is I can understand that, but I'm kind of wondering why there's such a large discrepancy between those 3 particular libraries. Does anybody know why?
Honestly, Pat, the answer to the question is we would have to find out from North Country Libraries because they provide that information to us. We don't make any decision on any one individual allocation. We are simply allocating to the total amount. How they break it down is a function of the library system.
Yeah, I kind of thought that was probably the case. Do you think we could get that explanation though?
Yes.
I'm just curious more than anything. I'm not throwing flags or anything at their, allocations. I'm just kind of curious. And so one more question, with the ag coordinator, is in the resolution, it says that there's a report given, 30 days prior to the termination of the contract, 30 days before, 30 days after. Can we get a copy of that report too for 2020?
Actually, what I believe is the case is we're seeing report almost monthly from the ag coordinator. Whether he does an annual report at this point is a good question, Pat. We'll find out. If there is an annual report, we will get it to you. But I do know that through our representative, which is Al Drake, on a monthly basis, there is I believe it's monthly, an update to all the board members.
Okay, very good. Excellent. Thank you.
3 things that we'll address for Legislator Jarrow. That will be the resolutions 14 through 7, any of those that qualify for potential bed tax allotment versus general fund allotment.
Mr. Chairman?
Yes, go ahead. Go ahead, Mr. Drake.
I thought that we had given us an annual report, but I could be mistaken, so I will forward to everybody.
I didn't catch that, Bob. Al, I'm sorry.
Okay, I thought that, Jade already sent in the report to everybody, but I could be wrong.
Oh, that Jay already sent the ag report. Well, so that Jay already sent the ag report in. Everybody. So we,
I could be wrong. I can't remember. He sent a lot of stuff.
yeah,
There's
so,
already quite a few things.
yep. So we'll follow up on that. We, three things we're going to follow up on for Legislator Gerald. We're going to look at 4 through 17, and we're going to punt that to the finance chair. He's going to nod his head. Yep, he's nodding his head. And for review of those that can be possibly moved from general fund to bed tax revenue. The bed tax revenue is getting down to the threshold, the fund balance in that account is getting down to the threshold that we kind of established a while back. We appropriated extra revenue out of there to the TI Council for some special services, but that is starting to get back down to the threshold that was established as a matter of policy. But in any event, which would accelerate that even, the use of that money and the constrict the growth of that fund balance if there was any. So, but we'll take a look at that.
Chairman?
Hold on. Let me just finish this thought. The ag report, we will look. If that hasn't been sent, we will make sure it gets to you. And see, I lost my thought. What was the third one, Mr. Jarrell?
The libraries.
The library formula. Yep. Got all that? So. Got that, Bob? Yep.
Thank you very much.
Yep. Further discussion, Mr. Ferris.
Yeah, I was talking to a gentleman with a couple hotels here in the city, and he was telling me that they were down so far an astronomical amount. So I think that bed tax this last year is probably going to be considerably less than it was in previous years.
Yeah, we'll take a look at it. Yep. But it's point well taken. Further discussions on resolutions 4 through 17? None. Okay. All in favor? All in favor?
Aye.
Aye.
Opposed? Carried. Okay. Alrighty. Then we will go on to can make sure all my buttons are pressed here. Resolution number 18, please.
Amending the 2020 county budget in relation to the Home Investment Partnership Grant Program.
Have a motion, please.
So moved. Monticelli.
Jelly?
Cantwell.
Well. Discussion. Good. Roll call.
Legislator Gerald,
Yes.
Cantwell,
Yeah.
Johnson,
Yes.
Brandt,
Yes.
Monticelli,
Yes.
Drake,
Yes.
Nabawanik,
Yes.
Peck,
John? He's frozen in amber. We'll come back to him, Bob.
okay. Domo,
Yes.
Maxon,
Yes.
Reed,
Yes.
Ferris,
Yes.
Alarko,
Yes.
McBride,
Yes.
Peck,
He's frozen again. Okay. Great. Okay, Peck's unfrozen. Go. Okay.
Yes.
And yes.
thanks.
And yes.
Yeah.
Put that on our agenda for next year too, is work on internet connection out in Great Bend. Okay, resolution number 19.
Amending the 2021 county budget to reappropriate home investment partnership grant program funds and recognize recapture funds.
We have a motion, please.
I'll make a motion.
Reed, second.
Anthony?
Dildo, second. Discussion. And roll call.
Legislator Peck? John?
Yes.
Abdolo?
Yes.
Johnson?
Yes.
Maxon?
Yes.
Ferris?
Yes.
Drake?
Yes.
Reed?
Yes.
Monticelli?
Yes.
Gerald?
Yes.
Cantwell?
Yes.
Yablowanic?
Yes.
McBride?
Yes.
Clarko?
Yes.
Grant?
Yes.
Gray?
Yes.
Motion carries.
Resolution number 20.
Amending the 2021 county budget to reappropriate community development block grant program funds.
We have a motion, please.
Motion, Bilbo?
Ferris, Dildo. I got that correct. Discussion. Yep, hold on. Dildo.
Yeah, just a question how we're gonna have this public hearing, with things that, the way they're going on now.
We will conduct the public hearing, not unlike what we're doing now. It'll be available for the public over the airwaves as we're taking place right this evening. Because it's doubtful at this point that we can have an open meeting in 2 weeks, which is when the public hearing will be held.
So we do, I believe we published the link anyhow.
Yes.
We're publishing the link so people can sign on
Yes.
or speak at a public hearing.
Okay, thank you.
Drake, you had your hand up.
Excuse me,
You have your
Scott.
hand raised. Did you want to speak?
No,
Okay.
thanks.
Okay. Further discussion? Roll call, please.
Legislator McBride?
Yes.
Cantwell?
Yes.
Johnson?
Yes.
Yablowanic?
Yes.
Doldo?
Yes.
Grant?
Yes.
Maxon?
Yes.
Gero?
Yes.
Ferris?
Yes.
Monticelli?
Yes.
Reed?
Yes.
Peck? Sounds like a yes.
Frozen again. Yep.
Clarko?
Yes.
Drake?
Yes.
Gray?
Peck is free.
Yeah.
It's got motion again. Yes. Did you vote yes, John? He's frozen again. Okay. All right. Resolution number 21.
Establishing time and place for public hearing related to the status of implementation of the 2018 Community Development Block Grant Housing Award.
Have a motion, please.
Ferris?
Ferris and Cantwell. Discussion. None? All in favor, aye?
Aye. Aye.
Aye. Opposed? Carried. Okay. That, my friends, and, oh, no. Oh, sorry. Jeez. Resolution number 22.
Appointment to jury board.
Have a motion, please.
By Paris.
Motion?
Second, Peck.
Paris.
Who did I have? Peck, who else?
Paris.
Did I hear Johnson? No.
Paris.
Harris, got it. Discussion? None? All in favor, aye?
Aye.
Aye. Opposed? Carried. Resolution number 23.
Reappointing members to the Watertown Jefferson County Area Transportation Council.
Have a motion, please? Johnson?
Goldo, second.
Dolo. Discussion? None? All in favor, aye?
Aye.
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 Opposed? Carried. Resolution number 24.
Appointing member to Samaritan Senior Village Board of Directors.
May I have a motion, please?
Goldo.
Dolo, second.
Monticelli.
Monticelli. Discussion? None? All in favor, aye?
Aye.
Aye.
Opposed? Opposed? Okay, carried. Got through that. Okay, that concludes the resolutions now. I'm trying to do it prematurely. So with that said, is there anything to come before the board that anybody would like to raise? Any issues? Anything? Mr. Maxon?
Thank you, Mr. Chairman. It was not even a month ago that we had our last meeting in December. Going into that meeting, let me just pull up the email, a direct quote that I think held sway with 9 members of our board. In my opinion, there's no need to deviate from our standing rules. The express purpose of having standards is to establish a process for orderly opportunity to affect the government. Here we are, not even a month later, an agenda came out that no single member of this board had the opportunity to have any input in. No committee had oversight over any of the resolutions, and yet, not even a month later, the members of this board saw fit to waive the same standing rules that last month were so vitally important. Here we are, waiving them to do business. I think that the hypocrisy is worth mentioning. I appreciate your time.
Thank you, Mr. Maxon. Anything else to come before the meeting?
Yes. Chairman,
Yes, Mr. Monticelli.
I'd just like to thank Legislator Maxon for not referring to anyone directly as hypocrites.
Okay, point well taken. Further discussion? Anything else to come before the board? Mr. Beck, do you have you have mic on?
I have many thoughts, but I guess the most pressing thing at this point is what's happening with vaccine rollout and what's our part to play at this point.
What's happening?
Loaded question.
I could keep you here for the rest of the night probably if you want to stay that long. The vaccine rollout is right now under the auspices or under the operation of the medical community, primarily Samaritan at this point. There are federal and there is also state operations running. So the system is a little clunky, and that's my favorite word right now because that's the way it is and that's the way it's going to be. The rollout is very finite groups that have been identified. If 1A and then you look at 1B and beyond, they have, specific targeted audiences that they are going for. So, and a lot of that is determined by the supply. It's a supply and demand issue. So a lot of it is in a very, and I'm talking moments notice, right? Within hours, they get, or less. Sometimes they get a delivery without any notice. And then they have the instructions that follow that say this group has to be vaccinated. And then they have to mobilize that group, and they have to get them vaccinated in a certain period of time there's a potential recall on the vaccines that have been distributed for that group. So it is, so it's very quick notice, very short notice, and very quick reaction time in order to get that group mobilized. And that will continue as we move through the rest of 1A and on to 1B, which of a broader base group. B is larger than 1A. It's going to be more complex to run, and it's probably going to be a lengthier time to run. And then eventually we will get to the general population, which will be very complex and a very intense operation. Do you have a more specific question than that, John, or? I don't know if we lost John. It is, just to say the least, it's a very complex operation. If we look at, we're looking at a potential possibly of somewhere up around 90,000 doses probably that we have to administer over a period of time. And if you look at the amount of testing that we've done since April, it's nowhere near 90,000. So that will give you the magnitude of what it's going to take to get this job done and the length of time that it's going to take the job. Also, administering the vaccine is a much more complex process than administering a test. I know in particular, there is one person who qualified under 1A and will vouch for what I say. There's a whole registration process when you come in, and then there's the actual vaccination process, and then there's a monitoring process. And that is a 15-minute waiting period at the end of the vaccine. And so it's a very labor-intensive operation if you've witnessed it. And we have to do that for a large group of people in a lot of doses. I was on the phone with CVPH, is Champlain Valley Physicians Hospital, this morning, and Dr. Rauter, he is the physician that's in charge of the hub operation. He basically was very point blank. This will be an operation that has exceeded anything that anybody has ever seen. It will exceed the vaccination for the polio virus. So it'll be an operation that nobody has ever witnessed in our lifetime, in anybody's lifetime. He said it very as best I can, right? We see that supply and demand is adjusted, and it's very last minute and very rapid response. And it's a very staff intensive operation, and that will be the continuation. That will be the major concern moving forward. And he basically said, we're flying the plane as we're building it. So.
Right. And you also, depending on the vaccine, you have to give a booster several weeks later, correct?
Yes, you have to, approximately 3 weeks. You have to have a booster. You have to have it the same. It has to be the same. You can't switch from
Same
Pfizer.
brand drug. Mm-hmm.
Same brand. So.
Yep. That's all.
So, okay. Any further questions, comments?
Chairman Goodley, this is Dan.
Yes.
Has there been any feedback as the participation factor of people that are eligible to take it but aren't deciding to take it?
We're working on that. Yes, Samaritan has, I've been in conversations with Andy Short. If anybody of you know him, he's a COO at Samaritan. I'm in regular conversations with him. They've got a high rate right now. I'm not exactly sure where it is, because right now it's a matter of this group is eligible and got to pump those people through as fast as we can. So really, the penetration is what you're looking for. Lewis County is right now reporting very, very low penetration. So very low, but I don't know where Jefferson County is. But if you subtract all of the constituencies out that we have to are you going to be vaccinated, or federal contractors, or Fort Drum, or whatever, if you're looking at roughly herd immunity, you're like 80%, you're looking at 47,000 people potentially. Just rough math. Don't hold me to it. If it changes, it's fluid. Times 2, that's 94,000 doses. So, and we haven't tested anywhere. You see the testing numbers every day. Yeah, what we've done since when? April, Bob? March. Well, but yeah, that's even worse. So you add another month. So we're 9 months into this process plus, and you look at our testing, then you look at what we have to vaccinate, and you can that just gives you of what's ahead of us. And that's, several providers doing the testing. So that will give you a magnitude of the operation. And we have a lot of people that are inquiring about, and we just don't have answers for people. Just simple. We just don't have answers when a lot of people inquiring about the vaccine. So it'll be an operation not undertaken by this county before. So fair to say, Bob?
Just for the good of the order, tomorrow afternoon late, and then on Thursday morning, a specific segment, public health will be doing vaccinations for approximately 200 patients that are being contacted now. And of course, it's part of the priority system. It has nothing to do with the general public, but that's the first doses that are going to be coming by way of public health.
Yep. So at some point, this will switch from Samaritan over to when we get to the general public, it'll switch to the public health responsibility. Ginger today, I mean, and she will tell you that we've planned for this for 18 years, but I will remind you that we've never executed. So, so let's hope all the good planning works out and comes to fruition as on paper. So, but it will be difficult. About it. Any other questions, comments? Yes, Mr. Montelli.
Chairman, I was listening to public radio. I think I heard that other areas of the country, I think more densely populated urban centers, that they were having a problem with penetration. And one of the things they set up was a 30-minute call list. Like you get out a list and you're guaranteeing that you'd show up within 30 minutes if you're called in the event that people, like the penetration that Legislator McBride was talking about, people not wanting, it's their turn, so to speak, and now there's a vacant space for a person. So I've heard about this on the radio. I thought I'd share that.
Yeah. So if you look at the public process, a lot of data and polling out there is that about 50% of the people are willing at this point to get vaccinated. So if you take that population that I just identified and you say the first 50% of that will be more elderly, more vulnerable population. It's also going to be in the wintertime. So it's going to be difficult to mobilize those people in the wintertime. So that's a complication. Then you get to the second 50% of that number, and it is a population that's currently resistant to the vaccination. So there's complications through this whole process. Public health, to their credit, is confident. So, and they are they, when you talk to them, they are, I think you would concur, right, Bob? They are very, they just are focused, very forward thinking, and know that they got a long, tall order ahead of them for a job, right? It's the best way to say it. They know what's out of them. And at the same time, we have to run case management, contact tracing, parallel to this operation. So they got their work cut out for them. Any other comments? Yes, Mr. Doldo.
Thanks. Just a question. Somebody that gets the vaccine and potentially comes down with COVID 2-3 days after the initial shot, do we know if there's any effects as far as the strength of the shot that was given, or, does it diminish the shot? Do we know of any data on that?
I have not heard. You're way out of my MO right now. Sorry, Anthony. I'm just going to tell you it's way out of my MO.
Yeah, I was just asked if, somebody gets a shot and all of a sudden they come down with it, I don't know if it helps them, if it actually diminishes the shot that they got, where they may have to, obviously they still have to get a second shot, but, the concern is what could happen, I guess, or, is there any diminishing of the actual shot itself for the initial shot? So just a question that was asked.
Yep. I don't know the answer to that. All I saw is that you can't drink. They recommend you don't drink before you get the vaccination. So I will promise you all folks, they'll get it tomorrow, and I'll keep promising tomorrow. That'll keep you all from drinking. Any other discussion, comments, questions? Mr. Monticelli?
I'm just busy laughing at your sobriety test.
We'll see if it works. Mr. Nemwanek?
Thank you, Mr. Chairman. No, I just want to thank you for the very informative update, and all along the way, keeping the board updated to the progress, and to hats off once again to public health for, we know what they've been doing down there, the hours they put in, and it did warm my heart to hear you say how dedicated and confident they are to keep trudging along here and get us over the finish line here this year. So thank you for the update.
Yep, you're welcome. They're probably going through their toughest time right now, Bob, I would say. I mean, they're by far their toughest time. They have the complications of the holidays that fell on a Friday before a weekend, and it seemed that everybody waited till Monday to go get tested and just flooded them, and they're working. Gosh, like God love them. I tell you, they're working, and they just are. You pick up the phone and they're genial. So you wouldn't expect that. You expect them to take your head off. So, but anyhow, they're good. Yep. Any other comments, questions, concerns? I'll entertain a motion to adjourn.
So moved.
Mr. Monticelli, second by Mr. Johnson. Any discussion? If not, you can sit here and discuss by yourself. All in favor?
Aye.
Have a good night, everyone.
Thank you.
Good night, everybody.
Thank you.
Good night.